Welcome to mmlearn.org and our program today for Train Your Employees. We're so glad that you could join us. I'm Maria Wellish, and I'm going to be your presenter today, and I'm very anxious for this topic to be something of interest to you, and I believe it will be. So today, our program is on preventing suicide in senior communities and promoting mental health as we do that. I want you to know that these programs are directed for independent living, assisted living, skilled nursing care, nursing homes that is, and also I believe that we're touching a lot of home health agencies and senior centers. So we hope that as you answer those surveys, you tell us other programs that you would be interested in as we move forward. Why is this topic so important? And it's interesting to me that I was in a meeting this week and one of our board members asked, why are we presenting on this topic? And I think that it is significant to know that this is a much bigger problem than any of us actually know about. When you work in long-term care and in continuum of care for a long enough period of time, you can hardly work in a facility that has not experienced a suicide. But if you haven't, we are so pleased, but we know what the national averages tell us. Older adults die by suicide at a much higher rate than the national average of people. And we're going to talk about that and the reasons why in a few minutes. And the rates go up significantly after the age of 65. In addition, when older adults attempt suicide, they are more likely to die. They are successful in their attempts. So why is this topic so important? Because of those three reasons. What do statistics tell us? Well, 1 out of every 4 older adults who attempt suicide dies. And 1 out of every 100 to 200 younger adults who attempt suicide die. Look at the difference in comparison. That goes back to they are more successful as they're older than somebody younger, and a lot of reasons for that. But those are the statistics we know. Some statistics that we're missing are there any reliable statistics on whether suicide in senior living communities are higher or lower than those that are living in the general community? And we don't have that knowledge at this time. What we know is that residents in senior communities have many of the risk factors that are associated with suicide, and that is depression, social isolation, a lack of a sense of purpose in their life, of course illness and pain as they age, and family losses. When we talk about family losses, I want to interject here, that doesn't mean just spouses, because many older people today that are in their 80s or 90s are losing their children who are in their 70s. So these are some of the risk factors, and we'll go into these in depth.